Health, where we are educating and informing all things Medicare and health insurance plans.
Welcome to Health, where we talk all things Medicare and healthcare plans. Today, our topic will be Medicare basics. We're just going to talk about Medicare 101. Just a little bit about myself. I am an insurance agent that has been in the business for over 16 years. I love every bit of it, and I love educating on Medicare plans. So today, let's just break it down a little bit. Medicare 101. I like to say it like this. Medicare beneficiaries have options. And we don't sell, we just show people their options. There are different parts to Medicare. You have Medicare Part A. Medicare Part A is hospital. Medicare Part A, I always say, that is what you work for. That's what you have to have your 40 credit hours for, or 10 years in order to have, for the most part, the Part A for your hospitalization. Well, you may say, well, if it's hospital, what if I want to go to the doctors? I'm glad that you asked. If you want anything other than a hospital, like labs, x-rays, outpatient services to see your primary physician specialist, this is the part that your Part B covers. A, you work for. B, you're going to pay for the rest of your life. You or a third party will pay a Part B premium. As of now, that Part B premium is $164.90. $164.90. Okay? So you may say, okay, there's Part A, there's Part B. Do we have any more parts? Absolutely. We do have other parts. And the Part C, so we talked about A, we talked about B, and let's talk about C. C is a Medicare Advantage plan. Part C is a Medicare Advantage plan. Okay, so what do the Part C does? I'm glad that you asked. Part C is ran by private companies such as United, Humana, Aetna, WellCare, Molina, Cigna, just to name a few. So what I'm saying is that this is how I like to explain it. In order to have a Part C, you have to be eligible for Parts A and B. So you cannot have C without A and B. When you have a Part C Medicare Advantage plan, why was that even created? Let's talk about why was it created. Medicare beneficiaries are living longer, and the populations for Medicare itself, it was overwhelming. So they partnered with these companies that we mentioned, these private companies, private ran health insurance companies, and they manage the care for your Medicare. So in doing that, not only do you have to cover what is covered by A and B originally without any plan, they also offer more benefits. So what you would get with your Part C, instead of your 20% out of pocket and your hospital deductible, what you would get is a the predictable pay co-insurance and the predictable co-payments. So you know up front, and I like to say that it's likened to a job insurance because you have co-payments when you go and you have co-insurance for certain services. So the Part C is added, and when it first came out with Part C, what happened was you also had a Part D, which you had two different cards. And because the cards was causing so much confusion, because the beneficiaries would take their one card, the say the Part D card, to the doctor, and the doctor said, we don't take this. And then they'll call the agent or the companies, and they're like, look, I got this plan and it don't even work. And it was because it was confusing to the beneficiary. So then what they did is they also embedded the Part D in later years. They embedded the Part D into the C. So when you get a Medicare Advantage plan, you have A, B, C, and D, unless you have elected to have a MA only plan, which is a Medicare Advantage plan without the Part D. So a Medicare Advantage plan is MAPD, which stands for Medicare Advantage as well as the prescription. Okay. So with that being said, let's talk about some of the enrollment periods. And when I say some, I mean some, because there's many enrollment periods, but let's just talk about a few. And the very first one that I want to talk about is the initial enrollment period, IEP. What do initial enrollment period stands? What does it mean? And when can I enroll my clients in using this initial enrollment period? The time that you're able to enroll and when they just are eligible for their Medicare's Part A and B, especially with their Part B, because some people, this is initially when you are just eligible with the Part B, because I don't want to confuse you. So let's keep it simple for you. So when you're eligible for Part D, and this is usually when you have been in a disability situation before the age of 65 for 24 months or 24 months. Once you hit that 2 years, in most cases, you are able to get Medicare. There's even sooner in some cases, like kidney dialysis. I believe it's like 4 months. So, but for the most part, we're just talking basic. For the most part, it's 2 years. And once they have receive disability for 2 years, then they're eligible for the Medicare A and B. When they become eligible for the A and B, then that's when you're able to put them on C using the initial enrollment period. In this initial enrollment period, you have 3 months prior to speak to the client, educate the client, and you're able to put them on for the date that their Medicare starts. So even though you write them up, it would not be until the date that their Medicare starts, which is 3 months in the future. Then you also have the month of that you can sign them up for, as well as 3 months after. So they literally have a 7-month period in this initial enrollment period. Okay. The other big one is when the client turns 65. They've put in their hours and they have parts A and B. This is a great candidate, and this is what you would use is the initial enrollment period for this. Okay, so that is the initial enrollment period. Then we have a special enrollment period. Now, this special enrollment period can be used for various things. One of them being LIS, right? One being Medicaid eligible, or any of those changes. Another one could be moving out of the area. There are several SEPs that can be used, and we can go down the list. The biggest one that I would like to talk about is your person who is Medicare or Social Security eligible for what we call help with their prescription. It's extra help, or LIS, low income subsidy. And if they are eligible for that, that is when you can use this period. And the reason why this period is so important, because this is a 9-month period for the most part. Here again, it's a 9-month period for the most part when you're talking about a Medicare LIS or a Medicaid eligible person. And what that means is that gives you, in addition to your annual enrollment period, you're able to use once a quarter for these other special enrollment elections that your client may have. Okay, such as the LIS or the Medicaid. So as an agent, I'm gonna give you a hint. It gives you an opportunity to work year round. Okay, I probably told a little too much. It gives you an opportunity to work year round. Okay. Then we also have another one that I would like to talk about, and I just skipped it, didn't I? It's the annual enrollment period. So your annual enrollment period is when we find, for, I don't have no tack. So let's just say, for lack of better words, we find people who are plan insurance, who jump in at the end of the year, and that's the only time that they write, and you don't see them anymore. I am a professional, and I work with my clients year round. I accumulate clients year round, and those who work with me does the same. So with that being said, as professionals, and this is what we do, annual enrollment election period, if you're working year round, you always have someone to see during this time. And not only that, initially what you want to do is check on your current clients, because everyone knows that in this business, people will flip your clients. So you have to make sure your clients, one, know that you're there, and two, they are up on what is changing from year to year, because there are changes. So I use this time, the annual enrollment or election period, I use this time to educate my clients on the products they have compared to what is out there, so no one else can come and say, oh, I don't know, so they won't say that they don't understand or don't know. I want them to know, and I want them to I be the first line of defense, so they can call me if they have any questions, because one, they trust me, and two, they know that I'm not working for a particular company. I am working for them. And when they have that assurance that I'm not going to make more money if I offer a certain product, I'm going to do their assessment and make sure what I am offering, or even showing them as an option, is a viable option for them. All right. So we talked about the three big ones, and that was the initial, the annual, as well as the special enrollment period. All right. We're going to continue right on. Let's continue on. Let's talk about some average cost and premiums. For the most part, I tell anybody, this is an easy sell, if you want to even call it a sell, because for the most part, Medicare Advantage plans are zero or very low cost. The premiums are zero and very low cost. And why would I say zero and not free? Because nothing is free. They are paying a Part B premium of $164.90. So that's why it's very important that as they are paying their premiums, their Part B premiums, that we always say zero and instead of free. But if you are educating yourself, you're able to educate your client, and you want each of your clients to get the most out of the plan that they choose. All right. Deductibles and co-payments. Now, from this will vary from plan to plan. For the most part, there is no medical deductibles. However, some plans do have medical deductibles. Particularly, you will find that plans that are for dual eligible clients, they will have the deductibles, but the client themselves will not pay for those deductibles on the medical as well as the Part D. Then you can also look individually at each plan. There are some plans that do have medical deductibles as well as Part D deductibles. So that is really important that all of that is talked about and explained so the client will know. Okay? Let me give you an example. I have, there is one of my plans that I represent. They, the client is a partially dual client and is eligible for the plan, but I educated my clients, and I wanted them to know that they probably will be doing themselves a disservice. So yes, you may have some of the extra benefits, but overall, that this plan would not be suitable for you. So when you explain, yes, you may get this, but you're not going to get this in this area to the client, then what you will find out is that they are educated enough to make the right decision. Absolutely. So again, what you do get with the Medicare Advantage plan is the predictable co-insurance and co-payments. Okay, so it's outlined in the summary of benefits. Okay, now initially, when a person is new to Medicare, we call new to Medicare, and with that initial enrollment period, what you want to do is give them all options. It is important that you give them all options. And why do I say all options? Because though I don't sell as many Medicare supplements plans, I do have clients on Medicare supplements, and that is the best for them. So we don't go in assuming what is best for our client. We give them the option. And a Medicare supplement is an option, and it's a viable option for someone who is just coming to Medicare. Why do I say that? Because at that time, if they're 65 years old, just coming to Medicare, this is the only, and I repeat, the only time that they will be able to get a Medicare supplement without underwritten questions. So if they got any issues, they will not be asked those questions for their when they are first come to Medicare. That is important that they know this option. You see why it's not our decision? It's not about our pockets. It's always going to be about the client. It's always going to be about the beneficiary and what is the better option for them. You educate and they choose by education. Okay? Let's just talk about additional information. And I did talk about this a little bit with the Medicare and Medicaid. One of the things that what will set you apart from any other agent is that you just go beyond what your title is as an insurance agent. And without going into vast detail, there is a lot of people that will qualify for Medicaid or partial Medicaid. As an agent, it is your due diligence to do your best for your client. It should be your due diligence to do the best for your client. With that being said, you may have to fill out some applications. Yeah. So basically what we've done is we talked about original Medicare versus Medicare Advantage. Yes, in short, you can have original Medicare only, plus the drug cost or drug plan, because it's going to be cost associated. Plus, you're going to have, if you have any supplemental like dental or vision, those would have to be standalone as well. And if you choose to, you could also have the Medicare supplement on the original Medicare side. So this would be your option. And then the second option would be the Medicare Advantage. And we went into that. In the Medicare Advantage, there is PPOs and there is HMOs. There is other plans out there as well, but those are the two main ones, is the PPO and the HMO. You would check for their doctors in network. It's in and out of network. If it's a PPO or in network only. And most of the Medicare Advantage plans are very rich in their provider directory. So I don't let anything scare me if it's going to be the best for my client. So if it's a PPO or HMO, if it's better for my client, better benefits, and they're and all their boxes are checked with their medicine and their doctors and hospitals, everybody's in the network, then maybe a HMO would be a better option for them. So what we do is we just go down a list and we actually see what is the best option, or I wouldn't say the best option, a better option for them, the more suitable option. Because in this Medicare world, we do not use what's best, because here again, they may choose what is the better option for them, but it's based on the education that you're giving them. I think that we have come to the end of our time together. Basically, what I want to tell you is that when we think of being an agent, we offer options to our clients. They have options, and within whatever you choose, they need to know what is available. What is their total cost? Because we are dealing with people who are on fixed incomes. And if you don't treat these people like you would treat your own family member, if you're good to your family members, then you should not represent these people. These people are special to me, and they should be special to you. Okay? So Medicare, we talked about Medicare 101, and we kept it pretty simple. And if you have any questions, any comments, please like, comment, and subscribe. And what we're going to continue to do is educate and inform you on all things Medicare plans and health insurance plans.